Dr. Roth here. Just wanted to share a interesting case of a woman I saw yesterday. Thought it would be worthwhile to share. So this was a 70-year-old woman, came to me because of significant short-term memory. She did have a mother who had Alzheimer's, but this patient has been checked for the ApoE gene and was not found to be at significantly high risk of Alzheimer's. She's a very healthy woman. She's vegetarian. That's controversial whether that's healthy or not. She is very active, very fit, but having significant short-term memory issues really affecting her life. She had seen neurology, she had seen psychiatry, neuropsych. She was started on memantine, which is a pharmaceutical for Alzheimer's, but not so effective, very modestly. She didn't notice any difference there. She's on a bunch of supplements and really hasn't noticed much. So did a deep dive into her lifestyle, her biochemistry, her biomarkers, as we do here at Magaziner Center for Wellness. Found on questioning that she denied any exposure to mold. I think she had said something about maybe a damp basement or something in her old house. We did end up checking her for mold on her first visit, and when she returned yesterday, we went over everything, and there was quite an interesting picture. First of all, low vitamin D, low vitamin B12, all normal based on general lab work. But remember, normal does not mean optimal. Her levels were certainly not optimal. Her omega-3 levels were extremely low. She had some various inflammatory markers. She was positive for an MTHFR genetic mutation, which is very common. Almost half the population seems to have it, but can affect how we detox. And that brings me back to what I was mentioning about the mold. She popped up positive for aspergillus penicillium, which is a neuroautotoxin, a gliotoxin. She popped up for having IgG antibodies to this mold, and it was significant. All her other molds that we tested for were pretty low in terms of IgG levels, but this one was significantly high. So upon further questioning, her sister did say that, she feels like she used to have a noticeable odor when she was living in her old house. I don't know when exactly she was exposed to this mold, but it's very likely, given her history, that she was. And given that it's a neurotoxin, she has this positive MTHFR gene mutation, which has to do with how we detox. So potentially a picture kind of being painted here of she had this environmental toxin that could affect her neuro functioning, and then her body was unable to detox it out. And remember, about half the population has this issue. And there's a lot of environmental toxins out there, as we know, from food, chemicals, all these things, mold. So that, along with low omega-3s, vitamin D, B12, some inflammation going on, it kind of paints this picture that her memory issues may be caused by these findings. Like I said, she's been through the conventional world, and as pretty much we all do on that side of things, we write prescriptions and they don't really do much, and nobody does a deep dive like this. Very few practices will do this kind of thing, and it's just so amazing what we find when we actually look and when we actually have time to talk to our patients. And so we're absolutely going to start right away with trying to optimize her levels, vitamins, minerals, fish oils, fatty acids. We're going to try to help her out with her genetic mutation by giving her methylated B vitamins. And we're going to help her with her detox of this mold. So we're going to try to kill the mold with antifungals, natural antifungals ideally, as well as some other treatments, oral supplements, IV supplementation, food, lifestyle, back to the vegetarian thing. I did talk to her about maybe bringing in fish oil, which she's reluctant, and also red meat if she's open to that for more B12, but we'll see. Lots to do for her, but she's got this significant memory issue, significantly affecting her life and her relationships. Luckily, we were able to find some things that I think have a good chance of being related, so I think that we have a good chance of seeing some benefit. I'll caveat that by saying memory issues tend to be very difficult to treat. She does have a history of Alzheimer's in the family. If this is Alzheimer's, it's often kind of too late to make really significant impacts if you don't act early and prevent it. Long-term goal is we can prevent these things. But right now, we have to do it this way, where we take these deep dives, and I'll keep you posted. All right, take care.